迎大家出席今
Welcome to today's press briefing. We have with us Dr. Chang Shok-kwan, Head of the Communicable Disease Branch of the Center for Health Protection, and Dr. Linda Yu of the Hospital Authority. We'll first hear from Dr. Chang about today's cases. Yesterday, we have confirmed 47 cases numbered 11212 to 11258. 25 males, 22 females, aged between 11 and 82. There are 4 imported cases, all N501Y strain. There are altogether 75 cases of concern. 37 of them are from the UK variant strain, 8 South Africa, 5 similar to Brazil, and 25 currently unclassified. For the 4 imported cases, they are from Pakistan, 2 from the Netherlands, they are related, and there's one from a number of places, Albania and Dubai, and it's the 12-day sample. Of the 43 local cases, 4 of them are currently untraceable. 39 cases are related to other cases, including 35 from Ursus Fitness Center. They are related to Ursus Fitness Center. Most of them are sent from quarantine centers to the hospital. Or when they are reached, they have been showing symptoms or they've been tested positive. Of the 35 cases, there are 25 that are customers there. 10 are close contacts from home or from workplace. There are 7 cases who are staff members, 75 customers, 33 or 13 of them are close contacts. For this cluster, the number of cases has reached 99. For the 4 currently untraceable cases, I've covered some of them yesterday. There is someone who is currently not working, living in Rhythm Garden, Block 3. It's a confirmed case. She's tested after giving birth, is positive. The other one is from sanatorium, is maintenance personnel. There are some close contacts. The number is 11246. The other one is 11243. The other one is 11252, not covered yesterday. Is later tested positive, living in South Horizons, Phase 2, Block 10. Working in Central, Wingfu Zhongshan. That person works in an office. There are some close contacts sent to the quarantine center. That person's been to Pure Fitness Yoga, but it was on the 19th of February and not since then. That person's got a high CT value. Starting from the 9th of March, that person had sore throat. So we'd like to know whether it's related to the gym. Currently, it is an untraceable case. The other one's 11255. Living in Choi Wah House, Choi Fai Estate. Is a lift repairman working for Mitsubishi. The person is asymptomatic. On the 11th of March, he was tested positive under office arrangement. On the 11th and 12th, the person's been to Wunwa House, Lokwa House, Hang-On House, and Kongyat House in Kongyat Estate, Heiwa House in Heiwa Estate, Samuel Ping Discipline Services Quarters, and on the 10th, he's been to Hon Chung House and Hong Park House in Wen Hon Estate. there are 1 or 2 people who work with that person, they will have to go to quarantine center. I've also mentioned a case yesterday. Is 1PT, someone working at 1PT. Well, we've checked. The person's been to URSS, as well as on the 4th and 9th, been to that gym. So 11242, starting from the 11th, started to feel unwell. On the 8th, tested negative. So we think that it might be related to someone who's been to the gym. So it's a related case. We have about a dozen preliminary positive cases. About 6 of them are currently untraceable cases. For the other cases, they are related to URSS or other cases. There is one 38-year-old, well, I'm talking about untraceable cases, a 38-year-old male working at the Hong Kong airport on the 6th floor VIP lounge. It's a person of project management. On the 10th of March, fever. Last working day, also 10th. That person lives in Tai Po. Sun Heng Hua Yuan. The second case is a 5-year-old. The child goes to Taiyang Yingmen Yaoziyan, a kindergarten in Yuen Long. On Mondays and Fridays, the child would go to class. Last time they went there was the 5th and the 6th. The child had a fever, went to Adventist. The child lives in Shek Wu Wai, Yuen Long. Is currently an untraceable case. The third one is a 49 female housewife, lives in Discovery Park Block 2. On the 11th, tested positive. Prior to that, on the 9th and 10th, she went to My Fitness at Jordan for yoga. Is currently unlinked to the Sai Ying Pun cluster. The 4th case is Yuen Long Kai Te. It's a construction company. That person lives in Ga Siu Tai in Robinson Road, mid-levels. The person doesn't have to go to construction site, but the colleagues will have to go to different sites. So we have to investigate to see if that's related to other cases. There is also one 65-year-old female, works in Chatham Road, 東茂商業大廈. She lives in Whampoa Garden. Is a currently unrelated case. On the 9th of March, she started to feel pain on her chest. She went to did a chest X-ray, found that there was some opacity, so it was sent to A&E. Last day of work was the 12th of March. She's had meals with her colleagues.
Another case, a 12-year-old kid studying in Kowloon Tong Government School, primary school. And the last day the kid went to school was 15th of March. And the child started to have fever on the 11th of March. And this is also a case with untraceable source. And another case was identified through the mandatory testing scheme. This is a couple who live in Diamond Building, same floor as the previous case, but they do not know each other. A male patient works in True Light Middle School, and if this is a positive case, the school has all the personnel in the school have to go through mandatory testing, and he was tested positive. So, Dr. Yu, please. Thank you. As of 9 a.m. This morning, in the past 24 hours, the HA had 61 cases and reported. In the past 24 hours, there are 28 patients who have been discharged. Up to now, there are 10,738 patients who have been discharged, and 233 patients are now hospitalized in the 21 hospitals under HA, and also in the North Lantau Island Hospital. And 13 of them are in serious case, 9 stable, and 211 stable. The bed used are 1,214 bed used. Utilization rate is 16.4%. And negative pressure wards 665. Utilization rate 69%. And the QE, there is a report about a 34-year-old pregnant woman. As mentioned by Dr. Chong, on the 1st of March, she gave birth to a baby in Queen Elizabeth Hospital. She was hospitalized on the 28th of March and was tested negative. On the 4th of March, she was discharged. And then the hospital received report from the CHP informing the HA that the patient was preliminary positive. So it showed that there was a pregnant woman who was in the same ward as this woman. So this is a registered nurse. The last day she went to work was the 26th of February. During the infectious period, she has not conducted any high-risk procedures, and all the health personnel had PPE on them, so none of them was classified as a close contact. But then the HA has arranged for all the personnel in the ward to undergo testing. Question time, please. Please raise your hand and wait till a microphone is passed on to you. Please also identify yourself and the media organization that you represent. I'm from Now TV. Regarding the fitness center cluster, it seems that there are cases from one PT gym and also like a pillow yoga. Are you worried that there might be an outbreak in other fitness centers and gyms? Will it be too late for you to ask people in these venues to go through testing? And also, it's mentioned that there are positive cases or sewage samples in the central district have shown virus. So what is the next step? Will you perhaps ask the buildings in those areas to go through testing or to have their sewage system tested? And also regarding the kindergarten, you just mentioned that there is a child studying in Yuen Long Taiyang Yingmen Yaji in the kindergarten. Can you perhaps give us the full name of that kindergarten? And also, there is one international school that is affected. Can you perhaps confirm whether all the students in the Colette International School have to go through testing? And for the Yuen Long kindergarten, do all the students have to go through testing? That is the Sun Island English Kindergarten. Yes, we've noticed that the patrons of Ursus Fitness might go to other fitness centers and gyms. So we have already asked all staff working in fitness centers to go through testing. We hope to be able to find some hidden cases through the testing. For the sewage samples, I have no further information. I think we have to wait for the relevant experts to give us more information. Regarding the Yuen Long Kindergarten, I don't have further information. I think we also have to wait till this evening when we have the formal notice prepared. For Calais School, the primary 3, we have already asked them to go through mandatory testing. For kindergarten students, we have to look at the conditions of the children, what sort of activities they had gone through, whether they had worn mask or whether they had worn the mask properly, etc. We have to look at the cases in further detail. Next, please. An English question.
Hello, Danny Lee, South China Morning Post. With so many buildings being put under mandatory testing and possibly more expected today, is Central and Western District now deemed a high-risk area? Are there any special advice to workers and residents living in that area? As the cluster seems to be spreading to certain professions, including lawyers, bankers, accountants, is there any advice for people working in these professions? Should they all be working from home or cancelling social activities? And at this rate, is it now time to consider a wider work from home policy at this time? And do you have a number at least of offices were not handled in the same manner, and of that, how positive as a result from the... Thank you.
We have preliminary around 32 residential buildings to be put under compulsory testing notice, and around 21 workplaces. These numbers may need to be further adjusted after confirmation. It's around 21 workplaces undergo compulsory testing notice. Of course, I mean, if the officers can arrange work from home, it's better than it's a better social distancing measure than gathering in the office, because if there is one case in the office, we might have to issue compulsory testing notice for all the workers there, and also may quarantine some close contacts. So we have not issued quarantine order for the Calais School classmates. Yeah, we issued compulsory testing notice for the students there. And usually, if the children are smaller, I mean, the compliance for the mask wearing may not be good. So for the kindergarten students and childcare centers or preschools, playgroups, etc., if they have confirmed cases, we might have to compulsory quarantine some of the other classmates. But for those bigger children, if they can wear masks without, very close activities, we will ask them to undergo testing. And yeah.
Just to clarify, from what we understood yesterday, there was a particular class that got sent to quarantine and they were allowed at least voluntarily. So I just wonder, was there any preliminary positive cases that came out of that?
We had discussed about whether to quarantine the students or issue compulsory testing notice for them because their ages are borderline 10 or 9. So after clarification, we understand they wear masks during the class and there was not much social activities, only teaching from the teacher. So we decided to issue quarantine. We have not put them to quarantine, but ask them to test as well instead.
下一位，嗰邊後邊。
Next, the one in red. I'm from TVB. This morning, Professor Leung said that the sewage samples taken at Central Western District tested positive, and the cluster has been spreading quite quickly. Isn't it urgent to identify as many cases as possible? Well, there may be the third generation transmission from the gym cluster. Do you think this outbreak is more serious than the dance outbreak? Currently, the government require people at the gym to wear masks, but with the outbreak, how effective it is to now require patrons to wear masks. You see that there are numerous buildings and workplaces that are put under the compulsory testing notices. I'm not aware of the situation with the sewage, but what you say is not surprising, but we will have to accord priority to see if there are other cases identified in the buildings under compulsory testing notices. It's very difficult to make a comparison with the dance cluster. Within a very short time, we see a large number of cases. Most of them are trainers or customers themselves, and a small number of close contacts. We try to identify their close contacts as quickly as possible in order to stop further transmission. The lady here. I'm from Mingpao. I would like to ask about the Ursus Fitness cluster. Just now, Dr. Chuang said that there are about a dozen preliminary positive cases. How many of them are related to this? Well, if they are counted, will the number of cases relating to this cluster go beyond 100? And if that is the case, would you be concerned? You mentioned about other confirmed cases going to other locations, say My Fitness or Pure Yoga. It's not established that they're related to Ursus. But do you think that gyms are high risk and it's high time all customers of all gyms be tested or that they be closed? You mentioned about a customer in Ursus who's been to one fitness and one PT. Can you give me the number of the case? The second question, Professor Gabriel Leung said that the sewage from Central Western Districts tested positive. Can you give us information about the distribution? Are they very close in proximity? Do you think that there is a chance of closure of building blocks? It's been criticized that there has been a number of occasions when certain streets and blocks have been closed on the Kowloon side because these are poor districts. And do you think that there will be further transmission among companies in finance or banking? We see that there are about 7 cases related to Ursus. They may be close contacts or customers. I don't have detailed information about sewage. For the closure of areas, I think it depends on the arrangement of the government. There are 32 residential buildings where confirmed cases have lived and 21 workplaces. Sorry, speakers not coming through. If you're really interested, you can refer to the list on the internet, but there is not much significance. The person in green, I'm from Hong Kong 01. First, I'd like to ask about the gym cluster. Is it still under control? We see that, well, there is a spread amongst offices or in the Central Western District. Are you concerned about another outbreak like the fourth one? For the gym cluster, there are 99 cases, but over 70 of them, 75 of them are staff members, and a number of them, and 33 of them are close contacts, and 7 staff members. Is that true? Is it true that the testing centers are understaffed because the efficiency is rather low, and I've heard from time to time cases of delayed result notifications? Maybe I wasn't clear. 7 staff members, 75 customers, and 17 close contacts. Well, there are cases when 2 people working in the same place have been to URSS, or maybe 2 or 3 from the same office, but not all of them have been to URSS. Yes, and there is a transmission at home or in workplaces. It is similar to previous outbreaks. I think that the 4th outbreak has not finished yet. We have never had 0 cases. So we are very concerned about the resurgence. For testing, I think the hospital authority as well as the government have asked their contractors to speed up their work. The gentleman over there, I'm from the Apple Daily. I'd like to ask about a case from Rhythm Garden. 11243. Yesterday, when Dr. Chong talked about this case, she said that she was unemployed, but the details are very close to a post by the police. It's a 34-year-old who's just given birth, and she's given birth at Queen Elizabeth Hospital. So she was discharged on the 4th of March. Has she come into contact with anyone during hospitalization? Last day of work is the 22nd. Where anyone from the workplace will have to be tested or quarantined?
According to our information, we learned that she hasn't been to work in the past 14 days. I'm not saying that she is unemployed. Well, I just mentioned that she is temporarily not working. Regarding this 34-year-old lady in Queen Elizabeth Hospital's any contacts in the hospital, I don't have information. We only understand that she has 1 close contact so far. Next English question, please.
I'm from RTHK. Will you have some of the names of some of the well-known companies that are issued with compulsory testing notices today? And also, I want to clarify if there are sufficient manpower to track the close contacts of the cases, and are the people from discipline services still helping to find close contacts? Thank you.
I don't have the detailed workplaces because there are so many. And we are still checking the exact address because some of them, I mean, we need to check the exact floor, those places where the patient works. Yeah, so we need to, you need to wait for the finalized list. So we have the contact tracing office with, I mean, more than 200 disciplinary force to help us to trace the contacts. So this has this is much faster than before.
好，如果冇其他提問，今日記者
If there are no further questions,